Hello friends, I am Dr. Parul Sathe. I am consultant, obstetrician, gynecologist and fertility specialist attached to Medicover Hospitals, Navi Mumbai. Today I will discuss about high-risk pregnancy. Almost all of us want to conceive and want to have a healthy baby. Most of the pregnancies are low-risk pregnancies, but 15 to 20% of them turn into high risk anytime. Many of the pregnancies are high risk to start with. So we should be very careful to choose the center, to choose the gynaec and to choose the hospital when we are planning this most beautiful moment of our life. If the pregnancy occurs very early, during the teenage, or it is very late, after 35 years of age, then it is labeled as a high-risk pregnancy. When you are starting your pregnancy and you are very thin, underweight, or you are overweight, again you fall into the category of high-risk pregnancy. To start off, if your BP is high, or you have diabetes, or you have hypothyroidism, or you have epilepsy, or any other medical disorder for that matter, if you have kidney disease, if you have any seizure disorder, if you have the thrombophilia, then it is again labeled as a high-risk pregnancy. If you have any history of infertility treatment, IVF conception, you again fall into high-risk category. If there is history of ectopic pregnancy or recurrent miscarriages in past, again the pregnancy becomes a high-risk pregnancy. One very common thing is previous LCS. If your first delivery is through cesarean section, again you fall into the category of high-risk pregnancy. So to start off, if you have history of all these things, you are into high-risk pregnancy, and when you come to me or when you go to your gynaec, again they evaluate first. They evaluate your history, they examine you, they see your weight, they see your BP, they take your basic investigations, we do your ultrasound, and anytime your low-risk pregnancy may get converted to high-risk pregnancy. If the BP during the first check is high, if the sugars in the first examination are high, if there is bleeding in the first 3 months of pregnancy, anytime during pregnancy BP goes high, sugars are high, if it is twin or triplet pregnancy, again it is a high-risk pregnancy. Moreover, it has been seen that during last 3 months of pregnancy, many a times any normal pregnancy gets converted to high-risk pregnancy. If you have abnormal bleeding, low-lying placenta, accidental separation of placenta, sometimes women just collapse before delivery, sometimes women just collapse after delivery. Sometimes there is very heavy bleeding after delivery that we need support. Women, they go in shock. We need support of physician, we need support of anesthetist, we need ICU backup, we need blood bank in such cases to save the mother and the baby. And that is the place, that is the time when the role of an expert and a good hospital comes into play. So be careful in choosing your gynaec and your hospital. Thank you.